Hi, I'm Dr. Isaac Howley of Lodestar Physical Therapy. I am here today with Dr. Ajit Dhaliwal. He is the founder of RegenHealth Physicians, which is a New York-based company, I guess, and you guys are now moving here to Salt Lake. Um,
We are. Yeah.
so awesome to have you on, man, and talking about
Thank you for having
regenerative
me.
medicine. It's cool. It's some cool stuff. Um, yeah, tell us a little bit about your story, how you got into
Yeah, yeah,
all
for
this
sure, for sure.
stuff.
First of all, I think regenerative medicine is definitely the future of medicine now. I think there's a big shift between preventive medicine than from reactive medicine. Because like being a physician for 15 years, it was always like, they come in a train wreck and you're like just putting them back to pieces, bandaging them up, and then go follow up with your primary care physician.
Yeah.
Now we're looking at health in a different kind of way. So I'm really excited to be a part of it. How it actually happened was I I play hockey because I'm Canadian, so it's my birthright.
Yeah.
Um, with my captain, did everything right that I was supposed to do. Got surgery by amazing orthopedic surgeons. Did physical therapy, which is extremely imperative to recovery. And after 6 months, I was like, okay, I'm still like I couldn't even hold my baby. He was 4 months old at the time, and I'm like, I promise you, he wasn't even that fat. So I really couldn't like hold him. And I was like, okay, I can't live like this. And then someone had told me about stem cells, and I was like, I don't want to, no offense to any country, but I'm like, I don't want to go to Colombia. I don't want to go to Mexico and,
Right.
try this.
Yeah.
But luckily, someone introduced me to a lab out of Atlanta. And because I'm a physician, they said they'll, administer it. I swear to God, it was like my Jesus moment. I was like, oh my God. So literally, I felt like Popeye eating spinach. And then better. So I was like, I need to do this in New York. And then I started my clinic. I'm either crazy, brave, or both, but that's what happened. And this was three and a
That's
half years ago.
that's awesome. That's cool. And now you're moving to Salt Lake. So this is
Well, yeah, we're
cool.
moving to the clinic to Salt Lake. It's
Yeah.
amazing. I think the environments and the communities it's really conducive to what
Mhm.
regenerative medicine is with in regards to like longevity, you know, also with the joints, restoring
Yeah.
joints and restoring joints.
Yeah.
With all the hiking and everything. So I think it's a great city to really build this up.
Yeah. Yeah, it is. And I have people, that ask too all about like, well, what's PRP? What's stem cells and stuff. And then here we are. And we're here with a doctor that does it. So tell us a
Yeah,
little bit about like what regenerative medicine is, like how it works, and like
for
just
sure.
kind of like the science behind it a little bit. Because I think people
Absolutely.
be like, what is this weird little injection gonna do? Right.
So yeah, yeah. So just like I can use an analogy. It's like a construction site. So stem cells are what made your body initially. It was like a blank construction. It was a huge construction site. It made your body. But now when we inject them, they're basically the construction workers to go back and do construction on your body that's kind of breaking down a little bit. So unlike surgery where it's repair by removal, like a demolition site, we're doing repair by regeneration. So we're sending in our construction workers and then basically rebuilding, repairing, and then also regenerating. So that's what that is. So again, that's what we're trying to do.
Yeah.
We're trying to do the alternative to surgery. Sometimes you do need surgery, but sometimes you don't.
Mhm.
And I
Yeah.
think this is a great alternative. And in regards to longevity, as you age, you get these cells that become zombie cells, right? Senescent cells. And as you age, it kind of just clump up and stay there. And they're zombie cells because they don't die. And all they do is like suck up all your energy and they kind of like cause this low grade inflammation. Well, stem cells go in, clear that out or help clear that out. So you can be,
Yeah.
21 again.
That would be that would be nice.
Yeah, yeah. So that was a long way to say it, but basically that's what stem cells do. Kind of like a reboot to your system, which is amazing.
That's cool. And like, what is a stem cell? How is it different than other cells? And like, where can
Yeah.
you put them? Can you put them anywhere, just in specific
Well, that's
spots,
a cool
or?
thing because they're kind of like the precursors, so they haven't differentiated yet. So they come in, they're blank, right? Like for example, when it was building your body, you were being born, they're going through the umbilical cord, and one was becoming a skin cell, one was becoming a cartilage cell, one was becoming a bone cell or a brain cell. So these aren't differentiated, but they will go in knowing what needs to be repaired and what needs to be rebuilt and regenerated.
That's cool.
So it's
Yeah,
really cool. It's like they're kind of like they don't know what their what their work is for the day or their plan, but then
yeah,
once they go in there, they figure it out.
that's cool. They're smart cells.
They're smart cells. And like it's cool when we do the IV, but then we also kind of guide them. That's why we do targeted
Yeah,
injections.
that's
Yeah.
cool. And you can
Yeah.
use them anywhere, right? Like not just like, oh, my knees hurt, so I need stem cells, right? You can use
No, you
them
can. Yeah. We do
anywhere.
aesthetics. We do hair restoration
Hmm.
because we're going to root problem and
Yeah,
regenerating the root, dormant root. So
that's
it's
cool.
cool. It's like
I might need a few
I
of
wasn't I
those.
wasn't saying it because of that. I was not. I swear to God. I
You
wasn't saying
can,
that. It's surprising. It's a surprising specialty that just like it's so cool how you can. There's so many applications for this, so many indications for stem cells.
yeah, yeah,
Next,
that's awesome. And
regenerative
it's
medicine.
and it's 100% legal.
Yeah, I would hope so. Otherwise,
Yeah.
I'd be in trouble.
Yeah.
It's funny because I was like telling you that I'm like it's one misconception that everyone has. It's like, oh, but is it legal? I heard it's illegal. I'm like, I don't my clinic here in Manhattan, the Upper East Side's definitely not in an alley. Like it's in an
Yeah.
actual medical building.
Yeah.
So it is,
We got a license.
yeah, exactly. Malpractice.
Yeah.
No, the thing is what it's not FDA approved yet. So it's still research based. And we do
Yeah.
research in our clinics, case reports and things like that. I mean, mind you, I don't practice anymore. Went towards the business side because I kind of have to run these.
Yeah.
But yeah, we still run clinical, kind of case reports and because we have
Mhm.
such a wide array of patients from neurology patients to joints to other hair restoration, things like that,
Right.
COPD.
Yeah. Oh, that's cool. So COPD, joints, hair,
Yeah, I know.
anything,
It sounds
what other
crazy. It's like I'm
disease?
selling. It's
Yeah.
like snake oil, but I'm not because at the end of the day, we are your body is the construction site. So I'm sending in construction workers. One day, you could have them specialize in the lung and specialize in something
That's
else, but that's where
crazy.
the exomes, yeah.
Yeah.
It is
I don't, yeah.
profound. 'Cause I'm like, I was an academic attending, so internal medicine. So I'm like teaching the residents and med students and stuff. And I'm like, the whole time I was like looking back and I'm like, stem cells, stem cells for that, stem cells for this.
Uh,
And but it's like actually applicable. So it's fascinating.
yeah, I don't think I've ever heard of stem cells for like COPD, right? Like it's
Okay.
always, maybe it's because I'm not in that field, but like I've
No,
always
it's
heard it
also
for
because
joints.
yeah, it's also because like a lot of these studies happen in China. A lot of these studies happen abroad.
Yeah.
A lot of these are
Hmm.
have been studied widely, and unfortunately, like America is a little behind. Like the
Yeah.
fact that for example, in Japan, stem cells are actually used as a treatment modality for Parkinson's, and of course, legal.
Yeah.
But actually,
Yeah.
it's actually a
Yeah.
part of the treatment plan. So
Huh.
it's so interesting. It's like we're focused on medications and pharmacological treatments, but then you have stem cells that can actually help. And studies have
Right.
shown has helped and decrease morbidity rates in Parkinson's.
Huh. That's cool. That is
Yeah.
awesome. And I think that's one thing too that people don't understand is like I feel like America, like the FDA is always slower than Europe or Asia or right. Like they always do all the research and then it's almost like the FDA uses the rest of the world as their testing ground.
Yeah.
And then they're like, okay, you guys have been doing it for 15 years. I guess we should bring it over here. Like,
It's true. And I get that, there's definitely a lot of like, regulation and all, they're obviously just
yeah.
they're trying to protect like, the general population. But then again, they also approved the opioid crisis, but we're not going to get into that.
We're
Please
not
cut
gonna get
that part
into
out.
that.
Please
Yeah,
cut that
yeah.
part out.
We don't need to get into that. Yeah.
Yeah, I don't want to get in trouble.
Yeah. So what is then the difference between like stem cells, PRP, And what other injections or regen medicine that you
So
do?
we have exosomes as well, right? So you have your stem cells, of course, construction workers. PRP is they're great for repair, right? And rebuilding, like the scaffolding on a building. They're good for repair. They build all that stuff up.
Hmm.
Exosomes are the messenger cells or the messages maybe that basically tell the stem cells, hey, we got a problem over here, right? So it's the stem cells
Yeah.
like telling the stem cell, hey, yeah, we gotta go fix up the bathroom over here or something in your
Okay.
house, right?
Yeah.
Or the
Yeah.
attic. And
Yeah.
then so all of these actually work synergistically. And then peptides, how they come in, peptides are actually like the work order. So it's like let's increase fat metabolism, like retatrutide. Let's increase
Mm.
fat metabolism. Let's suppress the appetite. Or, so something like
Right.
a BBC 157 and TB 500. Let's
Yeah.
go repair. There's a
Hmm.
faucet, or let's go repair that. Right. So it's similar to that. So
Okay.
all of this
Cool.
is what we kind of implement at Regen Health Physicians. It's not just like one thing will fix
Yeah.
everything. It's a bunch of things, a bunch of pieces that are part of the bigger picture.
So if someone comes to you and you're like, cool, yeah, this is totally going to help you out, do you hit them with all of those peptide stem cells and PRP, or do you just like usually pick one, see how that takes, and then move on to the others? What is the process between
No, of
going
course.
through
So it
that?
definitely depends on, like, say someone comes in with messed up knee and they just want a quick, I just want to do the knee.
Yeah.
For us, what we would love is to do the whole, like the whole picture. You start with
Hmm.
IV, stem cells and exosomes, really prime the system. Because what happens actually, even with peptides, like you have a receptor, these sludge cells, the zombie cells, stick right here. So only some of your peptide's going to work. You clear that
Gotcha.
out, you're going to need less of the peptide to make a bigger impact.
Yeah.
So if you look at it that way, so we prime the system, clear out all the crap, and then the peptides can work too, and we can start, help repairing, rebuilding, and regenerating whatever the injured part is. So all of it
That's cool.
just works synergistically. And the thing is, it's
Right.
so scientific. So it's not like this snake oil does this. It's like everything is methodical of how we treat our patients. Because we're not just thinking of your knee, we want your whole body to be doing
Hmm.
better. So like when we do inject the knee, you're still gonna get your stem cells that are already we infused into your body coming and helping as well. So you get the double effect.
Okay.
And then
Cool.
and then you have the peptides to sustain it and maintain that and
Right.
help continue the process of repair.
Oh, that's cool. And then how long or like how many? I mean, I'm sure it's all case dependent too, but
Oh, yeah.
like general sequencing of like, hey, cool, like two or three treatments of this, and then we hit you with this, or like to
So
where it's like, cool, 6 months out, you'll be okay, or is it 3 months, or is it?
yeah, so
Yeah.
usually what we like to say is there from our experience, one injection, and I hate to say is usually enough.
Hmm.
Sometimes you do need two, but it
Okay.
is obviously, the biggest hindrance of this is obviously the price and it's not covered by
Yeah.
insurance. But um and then when it comes to timeline, and then obviously there's certain programs or packages, not packages, but protocols that patients, um opt for example, that have all these other different remedies and modalities. In regards to time, that's the $1 million question, right?
Yeah.
Even when I was in the hospital, it's like, when am I gonna get better? I don't know.
Yeah.
Um,
Right.
but the timeline that we like to give is like it depends, of course, like comorbidities, the age of the patient,
Hmm.
what other are they using peptides? Are we doing exomes? Are we doing IV first? A lot of things, but usually we would like to say you're gonna get some, not some, but a significant amount of relief and function, not just pain relief. We need function. 3 to 6 months.
Cool.
Sometimes it can
That's
take
awesome.
12. Yeah, but
Yeah.
it's like they always ask me, they're like, hey, what's the side effect of stem cells? Patience.
Yeah.
Patience. This is not like an overnight, fix.
Yeah.
It takes time because this is a long-term fix. We're looking at,
Hmm.
dare I say, longevity here. So, so that's what we're doing. I think that's,
Yeah.
really important to understand.
Yeah, yeah, and I think, if you have like your stem cells, you just said 3 to 6 months, right?
Yeah.
Totally. you're looking at the same amount of time before you're feeling okay, right? And
Yeah.
really, like a total knee is that 6 months to a year is really what, like that year is kind of when, people are always like, yeah, I don't notice it anymore, right? But I mean, like surgery, PRP, it seems to be very similar in timeline, depending on the
Well,
surgery,
stem
but
cells. PRP is much faster.
or stem
Stem
cells, yeah.
cells.
Okay.
I mean, the timeline is different, but I mean, again, it's different how you look at it, right? Like we kind of alluded to was the fact that it's repair by removal. It's like a demolition site,
Hmm.
like a construction site. We're repairing by regeneration. And thing is, what's different is we want you to stay active. We want physical therapy. We want
Yeah.
the blood. It's just this is a different way. Like with surgery, you're still gonna have scar tissue. There's still so many different, so many. I hate to say this, so many. I don't want to say side effects, but there's so many complications. Like you could have
Yeah.
infection, you could have sepsis. There's so many things.
Hmm.
This is a small needle going in and injecting,
Yeah.
and of course, that's. And I don't want like. Sometimes you definitely need surgery. I don't want to say that you don't, but if you can try to prevent surgery or even at least delay it for years to come,
Hmm.
I think that's a plus.
Yeah. That's cool. That's awesome. How many physicians then do you have here in Salt Lake
So we clinicians, we have clinicians.
or clinicians? Okay.
We have two working at Salt Lake City, and then my sister, Dr. Ajit Dhaliwal, she's actually the chief medical officer of the whole company.
Oh,
So we're
cool.
planning on opening up more, but she's kind of overseeing the Salt Lake City clinic. It's going well, and I think success, the biggest part of our success will be the community. And I think that
Yeah.
the community outreach is really important. I've already been coming to Salt Lake since 2017 when I started my first company out of Salt Lake, which is a medical staffing company. So, I understand how important community is,
Hmm.
and word of mouth is everything. But we've been seeing great results already with the patients there. So hopefully,
Cool. Yeah.
we're a trusted name and a trusted clinic.
Yeah. Oh, that's awesome. That's so cool. Um, and you've been in New York obviously for 3 years then. So,
No, I've been in New York for 15.
or you've been, yeah, but okay, 15, but the
But I
company's
opened a
been there for
clinic, yeah,
3,
3 years.
right?
Yeah, New York's my home.
Okay. Okay. Yeah.
I'm a Canadian who's in
Who
New
lives in
York.
New York?
I don't know how to explain it.
I love it. No, it's good.
Yeah,
That's good.
absolutely.
And you have your grand opening coming up, right? Is that
Yeah,
right?
June 13th. We're really excited about it. Grand opening.
Cool.
We're gonna give off, 15% off of treatment. We really want people just to come in to know that we're available. I think it's a two-pronged approach. I mean, one is education, stem cells, legal stem cells.
Yeah.
Um, And then also, also awareness to let them know that we're
Yeah.
here and that we'd love to help you and that there's an alternative route. I think a lot of people, the way I feel like, again, like we talked about medicine, how people are shifting their thought process. Like, let's think about the
Mhm.
long-term remedy rather than the quick, like, okay, it's broken, let's fix it.
Yeah. Yeah. That's awesome. Yeah, it's super
Yeah,
cool how medicine
too
is.
bad you're gonna be gone. You're not
I
gonna
know
come
I
and
was
see.
I was really planning I was hoping I'd be there, but I will be gone.
Wait, it's
Maybe my
fine.
plane will come in and I'll just be like, I
No,
gotta
no, no.
go. I'm
You
gonna
you
catch the
enjoy you
last 30
enjoy no,
minutes.
no.
I don't know.
You enjoy it. That's awesome. Yeah, I mean, so
Yeah.
I have a question for you.
Yeah,
Like,
yeah.
what have you been seeing and like have patients brought up stem cell therapy? Because for us, okay, we obviously treat the patient, but to again maintain and sustain and like in that recovery, it's not an overnight fix. It takes time.
Hmm.
Physical therapy is extremely imperative.
Yeah.
Extremely, I can't stress enough how important it is
Hmm.
for even if you get surgery or stem cells, PT is what's gonna get you back to where you
Yeah.
want to go. So like tell me how it works for how it's been working for you. Like have people been bringing it up more
Yeah.
recently, or people
Yeah.
just don't know about it, or how does it work? How
Yeah,
is
I
the
think I think people just don't know enough about it, right? Like I've had some people in my career, I've had some people that are like, yeah, stem cells great. Like early in my career, I actually remember this one guy, he would go to Mexico and get it because it wasn't very popular here, right? It was like
or legal.
one clinic in all of the Western states that had it, like, but he'd go to Mexico and get it. But he's like, yeah, I've had it in my shoulder. I've had it in both knees. I've had it, and he's like, yeah, I think he's, for the most part, probably 75-80%. He's like, yeah, it works great. He's like,
Yeah.
and when I saw him, it was like, this was like the one time that it didn't work, he's like, it just feels off. He's like, I don't know if, and I can't remember what caused. I don't know if it was like a major trauma that he had to something. I can't remember why it wasn't quite working this time, um, but yeah, and I've had other people. Most people have good pain relief with it and good success with it to where it goes from, hey, I can't walk or it hurts every step to, you know what, I can live with this. This is great. They get little twinges here or there, but I
Yeah,
mean,
yeah.
my good knees still have twinges, like, so,
That's so important though, because it's like, like, say I had a bad back, right? I had to get surgery. This is
yeah,
another story. I got to get surgery. Still had sciatica. Got one injection of my stem cells, like from my clinic,
yeah,
and I'm better now. But thinking about I couldn't sleep properly. I was
hmm
depressed. What it does to your mental health, to be in pain, just screws up everything. And then
it
because you're
does.
asleep, you're not functioning properly, and then you're not yourself.
Hmm
And everything kind of, it's a slippery slope. And
Yeah,
me, for myself, like just knowing that, just going through that, you're like, I need anything to get out of this. And it's just like, and that's what stem cells are, literally regenerative medicine is saved my life in that regard. And I'm
yeah,
like, if I provide that, it give me a different purpose as a physician.
hmm
Because it's before I was, I guess, making sure they don't die. Now it's like making sure they live.
yeah, yeah,
Sense.
and live well. Like, it's one thing to be
Yeah.
alive, and it's one thing to actually like
Yeah.
live. You
And
know.
everyone talks about like lifespan and health span. Everyone's about health span now. It's like
Yep.
lifespan's about living longer. Health span's like
hmm
living longer, healthier. So that's
Yeah.
really important.
Right. Yeah. Just being like, hey, cool. I'm living. I died. And
I can live with my
that's it.
messed up back. Oh, I can live with, like you
Yeah.
don't have
Yeah.
to.
Yeah.
There,
Your
health is
lifespan is just like, cool. I'm just
I know, yeah,
down
yeah, yeah.
here.
It's like everyone's like, it's so funny. Everyone's like, oh, you hit. It always changes, right? Depends on how old you are.
Yeah. Yeah.
After 30, it goes downhill. Someone will say after 40, it goes downhill. I'm like, everyone just keeps talking about how it's going downhill. Why? Like we're at our peak where we're like just learning about life, and then once we figured it out, it just goes downhill. Like
Like,
that's not.
where did it
No,
go?
where's the optimism, right? Like it's like, oh, great. Well, here we are. Life sucks. Let's keep going.
Yeah. Yeah. It's totally true. And man, and I think also, like, where physical therapy comes in, kind of go more with your question here as well, as I mean, when you're in pain, your muscles, they will do anything to compensate around that pain, right?
Oh,
Certain
absolutely.
muscles just stop working, some will overwork, some, and it's like, cool, it gets you through whatever moment you're in until all of a sudden that compensation can't work again, right? And then you have bigger problems.
Yeah. Yeah,
To where
it's
it's cool when you have like stem cells and PRP and all this other regenerative stuff. It's like, cool, let's fix that, right? Joint pain might be better. Your muscles still think that it's injured. Muscles are stupid.
yeah, yeah.
Like, they just are. Um, and
They look
so
cool though.
PT comes along, right? We look at the biomechanics of where things are turning on, when they should be turning on. Once you start getting that to start work properly, it just helps the joint move better and
Oh,
helps
100%.
everything just prime and work the way it should. And a big hiccup in PT, or a thing that's a road bump, is when they have just pain with every motion, and you're like, "Ugh."
Oh,
Like,
yeah.
I can't work the muscle if you're always in pain.
Yeah.
So
I know. It's like yeah. And it's like you can't really you're just stuck essentially,
yeah,
right? You're stuck because it's
yeah,
like you can't make any progress because you're just stuck because of that pain,
yeah.
because of that big hurdle. So if we can find different ways to do, resolve that issue,
hmm
then you're looking at a very healthy, longer life.
Healthy
Going
long
this
life.
way, not this way.
Yeah, right. Yeah, I think I've met some people. Um, he might have had like PRP injections or something. I can't remember what. He had something, some type of regenerative medicine done. And I was talking to him. He's like, dude, I haven't felt this good in over 30 years, right? He was like
Yeah,
50 something. He's like the guy like, oh, once you turn
I get that too.
25,
Yeah, yeah. I have those patients that do that. I'm like, man, you're feeling better at 50 than I'm feeling right now. Like,
right?
and he's like,
They're
but you're my doctor. You're the one that made me feel this way. I'm like, you know what? Fair.
you're right. Yeah, but
You got
still,
a point there. You got a point there.
yeah,
But it's also it also has to do with like these people that are like now 50 feeling like the 30s because like they totally changed.
yeah,
Obviously, like so many things are important, right? Like your diet, your exercise, all that fun stuff. But it's like this just gives it that boost, and you're living this like whole
mhm,
longevity. You're living life with this whole longevity perspective.
yeah, yeah.
So
I think it's cool. When should somebody, right? Because I mean, there's pain and then there's like pain, right? Like, oh, cool, I just rolled my ankle or whatever, or oh, my knee is always hurting, or my hip is always hurting. When
yeah.
should somebody come see you and be like, oh, this might be a stem cell thing, or hey, maybe I just
I
have
think
a,
I think I think I think the things are going to change because right now they come to us right at the end when they're in a
yeah,
lot of, and we still do have significant, progress with them and significant success, but it takes so much longer. Like the hurdles and the journey is just more treacherous than it should be. And so
yeah,
right when you feel like something like your body is really good at just telling you, hey, this isn't working. Hey, this is messed up. But what we do is like we wait till it's like I can't function anymore. It's screwing up my day, screwing up my job, screwing up like picking up my kid or something. That's when
yeah,
we're like, maybe we should. I don't like doctors. I don't like going to doctors. Okay, cool. Like I don't either, and I'm a doctor. But don't wait until then. Like if you feel pain, you know when something's not right. You can't walk it off like when you're a kid. You
yeah,
can't walk this off. Like as you age, it gets harder and harder. So I
mhm,
would I would recommend like right when you start feeling pain, physical therapy and things like that. Remember, stem cells is not it's not like a major surgery. It's just
yeah,
I don't want to simplify it, but it is just an injection.
yeah,
So why not just go? It's like people love their cortisone shots. Yeah, it gives you relief temporarily. We're not looking for
mhm,
temporary relief. We're looking for long-term relief.
yeah. That's cool. So kind of walk us through then, like somebody calls your clinic, says, hey, I have shoulder pain. Um, they come in. What does that first visit look like?
Yeah.
And what do you kind of go over? How long is it? All that stuff. Yeah.
So initially, like someone has shoulder pain, but a lot of these people actually fly in.
Hmm.
Uh, because like you
Yeah.
said, there's only one in the Western states, right? So a lot of them do, and then you do first they talk to our staff, our VP of patient growth and advocacy. And then after that, we figure out the problem, we figure out the issues. They send their most recent blood results. If we need to if we need to make sure, we usually make sure they're within 3 months. And then obviously their imaging, and then we assess them, and then they can do, we kind of understand what the game plan is.
Yeah.
And with that, they'll either have a virtual consultation with one of the clinicians, or they'll just be like, okay, I'm coming. And then we just kind of review like what's going on. We also get the history and everything with one of our specialists. And then from that, we can come up with a plan. And we give them three options, right? We give them like a full treatment plan that we think would be great. That includes the peptides and all that stuff,
Hmm.
injection, maybe IV,
Yeah.
or they'll opt for just give me the injection in the knee and call it a day.
Cool. And the injection probably takes what, 10 minutes?
So we give an hour, I guess, slot for our patients,
Okay.
but
Yeah.
90% is just talking, getting to know our
Yeah.
patient. 10 minutes, less
Yeah.
than 10 minutes, it's eight
Once
minutes, but
once once you know where you're poking it, right? It's like, oh,
no,
it's
it's not like that. Yeah. And then
or
when we do the injection, we have an ultrasound to make sure,
yeah.
guided. But even though it's like, if you do an injection in the knee, there's only two places you're going, medially or laterally.
Yeah.
right? But it just helps us with the ultrasound because we can show the patient
Cool.
there's so much damage. Do you see this? So it's very
Right.
interactive. Like, they want to know.
That's
Instead of
cool.
waiting like 2 weeks for their MRI, we're like,
Yeah.
hey, so
And they could probably watch, can they watch the ultrasound as the needle's going in and
but
they'd be
I
like,
mean, a
oh,
lot don't. And you know
I
what's
don't know.
funny though? A lot of them, majority of them, they feel more pain with a freeze than the actual injection.
Oh, really?
Yeah. It's like, ah, and I'm like, I'm done. And they're like, wait,
You're like,
what?
what?
You're still in pain because of the freeze? Like it's just a spray too.
Yeah,
So
yeah, yeah.
we try to make it very, very comfortable for our patients.
Cool. Awesome.
Yeah,
That's
yeah, yeah.
awesome. It's cool. And then they
Uh,
walk out the door, so it's not like they're in
yeah,
any
they walk out the
braces
door.
or
Sometimes there's a lot of inflammation. Sometimes they need to, get some help, but majority
Mhm.
of them they walk out. But if you do
That's
both their
cool.
knees, then it's gonna be they're gonna a little bit of
A little
a
wobble out, but they're
little wobble, a little wobble. I don't want to say wobble. I was like trying to think of a different word. I was like,
yeah.
they walk slowly,
Yeah, yeah. Gingerly walking out the
gingerly.
door.
There you go. That's a good one. Walk gingerly.
Oh, that's cool.
Um,
Dude, this is
yeah, so
exciting though.
so
I'm excited to
yeah,
have you guys
but I
back in
do ask
town.
for one. Yeah, yeah, and I do ask for a favor from you. Just I love to keep the conversation going, the
Yeah.
progress. I'll see you in Salt Lake City, but more importantly, I think it's so cool that we're just having a discussion. But I think it's really
Mhm.
important to educate our patients, both yours and mine,
Yeah.
about how not only what stem cells do, but what stem cells and physical therapy, what kind of outcomes, what kind of satisfaction and pain relief and function that this can provide.
Yeah, I'm excited. And I'll know how to answer that question better when someone asks,
Exactly.
"What's a stem cell?" I'll be like, "Well, it's a cell that can become anything." And they're like, "What is that? What does that
Exactly.
mean?"
You got it. You
That's
got
my
it.
answer now. I'm like, "Well, it means it can be anything."
Yeah, yeah,
But now I'm like, "Cool, zombie cells and like
yeah, yeah.
clear it out,
I'm
repair
trying to
it."
always like try to make it so that people
Yeah.
understand, like
No, I
try to make it
love it.
interesting. Then I'll get way too medical and like physiological, and they're like,
Yeah.
I lost
People
you.
just start dozing off and you're like,
Yeah, they're like, I lost you style. I'm like, think of it as a construction site. And you're like, okay, now I understand.
Yeah, yeah, yeah. Yeah, no, that's cool. So yeah, now when people ask or are curious, now I can be like, hey, you know what? Give them some more information and pass them to you guys. So
No, I
um,
appreciate it. And
it's
Susie, thank you
exciting.
again for giving me the platform to at least talk to you and kind of explain what we do. And
Yeah,
honestly, I'm pretty sure this is going to be the first of many of these kind of
I hope
conversations.
so. Yeah, I hope so. Tell everybody where you're at, how to get a hold of you here in Salt Lake.
Yeah, so
And
we're in
then
Mill Creek. We're in Mill Creek. We are, um, yeah, we're our grand opening is June 13th. I'll drop you the all the information and the address and everything. And yeah, we'd love for everyone to come out and support us and hopefully teach you more about stem cells and what they are. And next time we'll have you there explaining what stem
yeah,
cells are.
cool. Yeah.
Uh,
And I'll let you correct me.
yeah, we're like whispering, we'll have an earpiece. I'm like, no, no,
Yeah.
no, retract,
No, no, that's
retract.
not this. Oh, wait, what was it? Okay.
Retract. Yeah,
I love it. That's cool.
sounds good.
Awesome. Yeah, and you guys are just going to be down the street from us on 3900 South, so
Yeah,
super close.
yeah, yeah,
It's
it'd be
going to be
awesome.
fun. So
Yeah. Thank you again
awesome.
for having me. I can't
Yeah,
wait.
thanks for coming on, and we will meet again. See
We
you later.
will. See ya.